This is Call the Psychiatrist. I'm Dr. David Handley.
And I'm Dr. Abby Snavely.
In this episode, we have a theme. Who is responsible for setting the agenda in a therapy session? Angie wonders if it's really up to her to bring up hard topics with her therapist. Chelsea's therapist doesn't ask questions about her life, leaving her to feel like her therapist doesn't care about her. Finally, Claire's therapist likes to explore the topics that interest him, and she finds herself trying to please him by playing up those aspects of her life.
Say you like me, you better count the ways.
Listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified healthcare professional regarding any medical questions or conditions. Why don't we start with a review? We'll set the bar high.
Okay, yeah.
This one came from Carrie. Can't get enough. This is one of the most entertaining and fun podcasts around. Abby and Dave are both extremely charismatic and funny. They never fail to make me laugh. This is one of the few podcasts where I actively look forward to the next episode coming out.
Wow. I love that.
I know, right?
I'm just going to print that off and read it every day.
Yeah.
Delete the Dave part.
So the bar is high. Oh, for our younger listeners, charisma is another word for Riz.
Okay. You can tell our middle school age children never listen to this podcast.
Yeah, my daughter would not agree with that review or think that's funny.
Any of that.
This first question comes from Angie.
I started therapy last year to help me address panic attacks and self-harm. We met once a week initially and moved to biweekly sessions. I told her in our first sessions that I experienced childhood sexual abuse, but that it was difficult for me to talk about in detail. Since I spoke of it, she has never said another word or asked me any specific questions. It's like I never opened my mouth. I don't know what I expected, but I've kind of thought she would help me talk about it since we both know it exists. Isn't it her job to help me talk about hard things? Instead, we do address my day-to-day struggles and my panic attacks are lessening. But I really want to make progress on this bigger issue. Is it really my job to bring it forward again? If so, what can I expect from my therapist in a way of support?
So I think in this question, we're looking for a new agenda. Like they haven't realigned their goals after they made some progress. It sounds like she came in with something very acute and distressing, the panic attacks and the self-harm. So I'm guessing her therapist took a here and now approach to try to contain some of those things.
Well,
and it worked.
Some symptom relief. Right?
Yeah. And it worked, or at least it's working. She says her panic attacks are lessening. But now Angie's wanting to pivot now that she feels better. She wants to look at the past and how that may relate to the present. So she wants to go bigger, as she said. I think they have accomplished something. It's just they may have cleared one agenda and need to work towards the other one.
Yeah, I mean, I hear what you're saying. I think there's, I don't know what, technique or orientation questions here from the therapist perspective. So, Angie says she wants to make progress on this bigger issue, which I think means the childhood sexual abuse. And I don't know what that looks like for her. Is it that she wants to be able to talk about it and understand it? I would say that that's a very worthy goal, Dave, that you named, to understand how the past relates to the present. I'm not exactly sure that, I don't know if Angie's there yet, right? Like, I don't know how she's putting that together. And, I think some people would say, okay, if the childhood sexual abuse was some sort of antecedent or a contributor to the current symptoms, then if the symptoms are better, then you may or may not need to go back there. Like, I'm not sure what the evidence is in Angie's life that the childhood sexual abuse hasn't been worked through. You know what I mean? I think sometimes things, either symptoms get better that you didn't even know a person had, or the sequela or consequences of whatever the trauma was in the past have been taken care of. So what does that mean to work through trauma? And I guess, how does she know she hasn't?
Well, I think people assume you have to do that work, whatever that means, whatever the work means, when it may or may not be necessary. And so,
I literally don't know what it means here.
Well, so for the therapist, they may think, well, you're getting better. We're addressing the things in the present. We don't necessarily need to go back to that. Some people wouldn't want to go back to that. Some therapists might not even want to go back to that, depending on their orientation.
Exactly.
Of course, it's fine to talk about, what are our goals? What are our approach going to be? I also think even if the therapist wanted to go back and revisit it, she may be working on the timing. I mean, there's that idea that I always have, like, you have to put out the fire you have before you light a new one. And so we can assume that going back and talking about the trauma will be a destabilizing thing for Angie.
Right.
And so,
And
especially
that therapist might well want to have the self-harm under control before that happens.
I think especially
Have
because
other
the
coping
self-harm.
skills. Yeah.
Yeah. I think she's going to need a little bit more emotional supports in place. At least that's what I'm assuming the therapist is thinking.
Right.
If they need to address it at all, she's thinking we may not be quite there yet before I'm going to regress you by getting into some of this past stuff.
Right.
And then the other thing is the therapist might be noticing that Angie isn't pursuing the discussion,
Yeah.
which then the therapist is using that as evidence that she's not ready to get into it.
Right.
And so she doesn't want to push her into it.
And I mean, I really get the tension here and the push-pull. For example, Angie says, well, I told her about this childhood sexual abuse, but it was hard for me to talk about. And from the therapist's standpoint, if somebody comes in and says, this is really hard for me to talk about, and you're sort of like, well, tough toenails, let's talk about it anyway. Like, that's not very empathic. You know what I mean?
Right.
Maybe the therapist could have said something about talking about it in the future or marking it, but I don't think that the therapist has forgotten about it and might well be, in her mind, making connections. It doesn't sound like she's making these kind of interpretations, linking current behavior or issues to that sexual abuse, but that doesn't mean she hasn't flagged it or hasn't incorporated it into her understanding of Angie. It sounds like it would be helpful for Angie to, maybe hear some of that or what's happening behind the scenes, if you will. But, I guess I'm just wondering, is there something else that Angie's dissatisfied with besides not having the opportunity to recount this story in more detail?
I don't know. Yeah, I think.
Yeah, I don't know. I mean, these are real questions.
Yeah, and it may just be something about expectations about how she assumed therapy was going to work.
Right.
I don't know. So, because I keep thinking from the therapist's perspective.
Isn't it her job to make me talk about hard things? Like,
yeah, well,
not necessarily.
It depends on how you're doing, and she's doing a little better.
Depends on how you're doing, what the orientation is, like you said, what the goals are.
And so I think from the therapist's perspective, they're meeting a goal.
Yeah.
And they just simply haven't had a chance to have the conversation, or they missed the conversation about what's next. So I'm someone, just my style, I guess, is I would be bringing it up and talking about the pros and cons and the timing. But I also think it's completely fine if Angie's the one that takes the reins to have that conversation.
Totally.
Are we going to be talking about this or not? Because I would say, like you said, mark it, orient towards it. Like I would say things like, there is this thing we haven't talked about. Now we can, and we can explore that. And this is what that's.
But you would also say that if you thought there, I assume if there was like a moment in the session where you felt like this was there, kind of lurking, there was a connection.
We did a lot of work to walk around it. And so we actually need to acknowledge that we're walking around it.
Right.
Do we want to get into it? Is that's going to probably open up another 9 months of our work together versus.
And something, some big issue in general, even if somebody thinks it's their biggest issue, if it is hard to talk about for whatever reason, but especially something that has to do with shame, which childhood sexual abuse or sexual abuse often does, a year at once a week or twice a week probably isn't, I don't feel like that's a totally unreasonable amount of time to take to kind of work up to that. Not that that's the only goal, but I think it could take quite a while to get to the level of trust, depending on how Angie's oriented and what her attachments are like, things like that. It could take a really long time for them both to feel safe talking about it. Good luck, Angie. I bet you'll get there.
Cha 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 cha.
This question comes from Chelsea. My therapist rarely asks me questions about certain aspects of my life, such as family, my boyfriend, or majorly traumatic events I've brought up before. I know waiting for a client to bring up topics can be a tool that's a part of certain frameworks, but it makes me feel like she doesn't care about my life. Is this unusual? Well, I'm wondering, what do they talk about? There's not that much left. It's like,
the past.
There's work
family,
or school. I don't know.
Your life. I mean, maybe this is some skills-based kind of thing, but yeah, usually you do care about
relationships in your life.
Relationships. Yeah. I mean, that's where it's at.
Yeah. So I think the problem here is there seems to be no agenda, much less who's controlling the agenda. They don't seem to have one, at least from the question.
Well, I mean, I will put a plug in for psychoanalytic theory here, though. Again, if that's what the therapist is doing, the therapist needs to tell Chelsea.
Well, yeah, you would still orient them to that. Like if you wanted just free association,
you would still say, yes, this is free association. You're supposed to come in Say what's on your mind. I'll say something if I think it's helpful. Really, we're trying to figure out how your mind works. Nothing is too small, right?
Yeah, and that's not going
relevant.
on. If
I know,
she,
but I'm giving
yeah,
a speech. I'm just, this is a little psychoeducation for the listeners, and a nod to Chelsea's question of like, of course, right? Like, yes, it's a part of certain frameworks, and it definitely doesn't mean, if that's what they're doing, it definitely doesn't mean they don't care. They might not care, but I don't think that this is kind of an equal, like, oh, they don't ask certain questions, and that means they don't care.
But I still think you should have had the psychoeducation around it, or she wouldn't have been asking the question. I know.
Dave, we're agreeing. We're not
know.
arguing. I promise. This is like talking to my husband.
So, so there are more passive types of therapies, but I actually think this has to do with more of a passive type of therapist. And so I think ideally on our best days, we're active and we're eliciting things from a patient when you need to, and you're passive and you're following their lead when you need to. And there's benefit to each approach if you're timing it correctly and you're attuned. But when you're passive and you're letting the patient set the agenda, you're listening to what they're saying, but also what they're leaving out, because that's always important.
And you might say, as you said in response to Angie's question, you mentioned this boyfriend, but I haven't heard much about him, So, like, you could just flag it and see what happens.
Oh, and the same, like with Angie's question, if she's not revisiting the trauma, then that from the therapist point of view, that means that she may not be ready. And that if the therapist pushed that agenda, then she could do more harm than good.
Correct.
So that's the justification for not pursuing it.
But some of this, is timing, right? We don't have as much context here for how long they've been working together or how frequently, what Chelsea said she was looking for when she came in. But yeah, I mean, I think they just need to have a conversation about this. Yeah,
this what's really lacking is there doesn't seem to be, again, there's no orientation about how this works or what the style is. Because I think even if what we're saying is what the therapist is doing, by not showing her cards a bit more, she's setting it up for exactly what Chelsea's experiencing, which is that she thinks that the therapist doesn't care.
Right. Again, maybe this comes back to technique, but I'm curious, so the family, the boyfriend, the trauma, all was disclosed or communicated to the therapist at some point. Does that mean that the therapist asked a bunch of questions at the beginning and then has changed, which is something that I tend to do, but I always flag it. Like the first few sessions, I might ask a ton of questions. I'm trying to get a really complete history. I'm also trying to flag, even if it is going to be a long time in the future, I will ask about things that maybe seem sensitive or difficult, A, because I want to know, but B, because I want to signal that these are things I'm curious about as we move forward, and then I might say, but then I'm going to, take a back seat and listen. Again, I'll say something if I think it's going to be helpful, but, in the third or fourth session, I try to signal like, I'm going to be a little bit different now, but here's why. And here's why I think it's helpful. And I can turn that up or down depending on what the person needs. So was it that, or was it that Chelsea came in and talked a lot and gave a lot of details and dumped it all out for the therapist, which is like sometimes very helpful. Sometimes I just, ask people to talk and they talk and that's great. But, I guess I don't know. And it's like, so was Chelsea comfortable disclosing things and now she's not? Or was the therapist asking questions, but now she's not? It feels like somehow these issues were brought up in the room, but I don't understand what changed and how.
I know, because even at the most passive, where you just say, what's on your mind?
Yeah.
Then Chelsea would be, well, I want to talk about my boyfriend.
Yeah. What's on your mind? Where'd your mind go?
Yeah, I wish I just had a little more detail about, I went in for this reason.
Right.
Maybe there's something that they focus really intently on. Or, you know what I mean?
I do know what you mean. But the answer is we don't know. That's what I was trying to say. Like something happened. Right?
Yeah. But she got data and then did nothing. Then nothing has happened with that data.
Well, something is happening. They're talking about something.
I know. And
that's what she says. She's not asking me about certain aspects of my life.
What aspects is she talking about?
Is she talking about her job?
Her mom?
Did she come in saying, this is my crisis about my child? I don't know.
I was imagining an EAP, where you come in, you're like, I'm having trouble with my colleague and my boss. And so then you structure every session around your colleague and your boss.
Right.
And you have like 8 sessions. And so
Yes.
you're just going to do that.
And that's why I'm like, I don't understand. Like, they're missing the expectations here. So I think that's a great example.
And that's why I was saying that was one without an agenda. Like, but I was using the agenda just to tie it together, but it's like, you have to have goals. Like, what are your goals here?
Of course. And everybody has a chief complaint. And then once you worked through it, I guess, I'm sure you have too. I've definitely been like, well, we worked on this issue with your boss, but I think you actually have a problem with your husband. Like,
right. I think a lot of times there's a thread that you can pull, and it's like, should we pull it? Something's going to unravel.
Right.
If you feel like we've accomplished something over here, though, we don't have to go poking around over here.
Yeah, we definitely don't. And if you don't want to, or the other thing, I've had some people be like, well, you never ask about my boyfriend. And it's like, you come in here and just release a diatribe about your boss every week. Like, there's no room.
Mm-hmm.
I mean, Chelsea was not wordy in her question, so she's probably not that much of a talker in her session. And again, if somebody's not talking about something, maybe it's because they don't need to talk about it, or maybe it's because they do. I guess my point is, like you said, they're talking about something.
Something has to fill the 45 minutes for sure. I want to align with Chelsea too, that just for me personally, this level of passivity would irritate me.
Sure.
Like I think a little bit of transparency about the process, about the orientation is important. This has come up in past episodes.
I think it's super important. And I think that I think you can be relatively quiet or less active, but still demonstrate and communicate curiosity as a therapist. And for whatever reason, that's not coming through. And that is on the therapist.
Yeah.
Right.
Well, I think maybe my advice for Chelsea then is it's okay at the next session to set the agenda, to say, today I want to talk about my boyfriend, or I want to talk about this horrible thing from the past from several years ago. That's completely okay.
Yeah.
I think if this
relationship, you can just say what you want.
Yeah. And if this relationship's going to work, then the therapist should be able to tolerate that. It should not be a problem at all.
Right. And if that's hard or feels impossible, then I think you say, I want to set an agenda, but that feels impossible. And then you guys can talk about the obstacle.
Right? I like it.
Well, this might not be the only place Chelsea has a hard time advocating for her needs, but that would also be helpful for the therapist to know.
Yeah. Good point.
Okay.
All right. I hope that's helpful, Chelsea.
Cha, 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 cha.
This last question comes from Claire.
My therapist seems to only like to explore topics that interest him versus what I feel I need to work on. Sometimes I notice him becoming extremely enthusiastic and engaged when he gets the chance to probe into certain areas. But when I feel something is important and more pressing, we rarely delve into it. Sometimes I like the fact that he's engaged, and it almost makes me want to play up those aspects of my life for attention. How do I get away from this? And should I point out my observation?
Well, I think this is interesting. Unlike the first 2 questions, now the therapist is the one pushing the agenda.
We just can't win, Dave.
It's
hard to get. It is hard to get it just right.
Yeah.
So yes, you should point it out. Absolutely.
Well, I think, the ones he's responding to, I assume he thinks those are important for Claire, but he's got to be more clear about that rather than just shaping her behavior with this weird positive reinforcement thing. He's leaving her out of the process. And if Claire thinks something's important, you can't ignore that. He may not even agree with her, but you have to pursue it and find out why she thinks it's important. I mean, her feelings are actually important.
Yeah, as it turns out.
It turns out, he can't know everything. You have to have some humility about this. And, we say this a lot, but you have to remind yourself that the patient is the expert of their own mind. So he can't know more than she knows. The setup is very unfortunate.
No, it really is. And I mean, I think there are, like, trauma came up in those first 2 questions. And so I do think that there are therapists, maybe especially early career therapists, who are going to get really excited when somebody mentions trauma, right? Because it's like, well, that's where it's at. Like, that's where the money is. Enthusiastic and engaged. If somebody's talking about something painful, like, we want to make sure the vibes are right. And so, I think therapists could go after something if it doesn't feel personal to Claire because of that kind of a reason. I think I've mentioned this before. I used to do this group therapy, and they would accuse me of getting really excited when they cried.
like Oprah, like Barbara Walters. Yeah.
And they're like, oh, that's all you want. Like, we're giving you what you want. And it wasn't because I wanted them to feel pain, right? And they probably weren't wrong that there was some...
that you're sadistic.
Yeah, that I'm sadistic. In this case, I don't think it was as much about my sadism as the idea that, like, there's a saying of follow the affect, right? So if someone's getting emotional about something, I take that as a signal that we're on to something, right?
Sure.
And lean into that a little bit. And it's like, okay, what is happening that finally got through and the tears have come, right?
Mm.
Not that that's always the case with crying, but for people who are hesitant to cry, I think that that's definitely there.
Mm-hmm.
But again, I want to point out that it was more, for me, it wasn't because like, oh, like now we're getting to the good stuff. Like now we're getting to the trauma. It's like now we're getting to the feelings, not just telling the story.
Right.
And so is it about certain topics? Is it about Claire's affect when she's talking about these topics that he's getting interested in, for better or worse? Is he like a trauma therapist, in quotes, who wants to talk about trauma? Like, is there something about his orientation that kind of lets you know that he values some things above others? Not that that makes it okay. I'm just trying to figure out what's going on the other side.
Yeah, because they've set up this scenario where now she's performing for him, which means he could very well be on the wrong trail. You know, so I do wonder. I feel like she has to bring this up, not only because of the agenda part, but because she's feeling invalidated.
Yeah.
But I also wonder if they're enacting something here. Like, does Claire actually go out of her way to please other people?
Yeah.
I mean, I can relate to that. I mean, give me a person with authority and I'll do my best to entertain them, even if I'm paying them.
Right?
Yeah,
I mean,
right.
Mm-hmm.
So if there's a problem here, I mean, the therapist doesn't seem to be aware that he's doing this, or, and this could be worse, he's just fine rewarding her for staying on his agenda.
I know.
Like, in which case he's actually controlling.
I mean, my mind goes to bad places. Like if it's sexual content every time, like that would be a red flag.
Yeah.
If he's sort of also getting activated by it. I don't think there's any indication of that necessarily. But I guess part of the big fundamental question is going to be, is his engagement around these topics, does it have more to do with him or more to do with her needs?
Yeah.
And that's going to be really hard to tease out.
I think even if there's not an enactment, like maybe this isn't a pattern for Claire, it is common for patients to try to play the role of a good patient and try to please us. But it's obvious to say you're not going to get as much out of therapy if you do that.
And some therapists, like me, if somebody can tell me that they don't like what I'm doing, I mean, not constantly and every time. But, well, that's a different kind of problem, right? But it's like if we get there, I think that's really good. I think that's a really healthy relationship, right? To try to work that out. And, hopefully don't reward the sort of conflict or the criticism too much. It's probably asking for it, but, it's okay. You can also be a good patient by sometimes being challenging or talking about difficult things or advocating for yourself. I mean, that is something that I think often I want to celebrate in people who maybe do have a hard time initiating or advocating. If they can do it with me, that's great. It's a great step and it's great practice for the rest of their life. So there's a lot of ways to be a good patient.
To that end, Claire, the fact that Claire is observing all of this means she's really set up for getting a lot out of this once they can get past this.
Yeah, she's tuned into him. And I think, using that as part of the therapy would be super helpful.
All right. Well, hope that helps, Claire. Thank you all for listening, and a special thanks to Angie, Chelsea, and Claire for the questions. As always, we love getting your reviews, your feedback, and your questions. Send us an email or leave an audio message at our website, callthepsychiatrist.com, or email us directly at callthepsychiatrist@gmail.com. Please tell everyone you know about the show so we can find new listeners. Take care.
Bye. No, I don't have one.
Skibbity.
Skibbity
Sigma. Toilet.
Bye, Skibbity. What do we even say? I don't even think bruh. I don't think bruh counts. The teenagers are done.
You're really giving mother. I'm gagged.
I can't. I'm like, ugh. You should see my face. I learned it from my son.